I'm Dr. Gurpreet Padda, surgeon anesthesiologist, interventional pain, and regenerative medicine physician, and I'm here to speak an uncomfortable truth. I'll start with a confession because I don't believe in the sterile white coat hierarchy. For years, I ran patients through the exact loop that's failing you. Refer to PT, watch them improve, watch them relapse, refer again. I was a cog in a machine that treated the motion of your knee while ignoring the biology. That's why your pain keeps coming back. You were given a mechanical fix for a problem that is only partly mechanical. Let me show you the part nobody fixed. You did everything right. You showed up, you did the exercises, you felt real progress, and then weeks later, the pain crept back like it had been waiting. So you wonder if you did something wrong, if you're weak, if you're just getting old. You are none of those things. The exercises strengthened the muscle around a joint that is still chemically on fire. Of course it came back. Strengthening alone cannot hold when the biological terrain is sabotaging the mechanical repair. Here's what I'll give you. The specific reason strengthening doesn't hold, the biological driver reigniting your knee, and the blueprint to make PT actually stick. Physical therapy targets the machinery, muscle, control, load. Necessary but incomplete because a degenerating joint is driven by inflammation at the cellular level. Inside that knee, pro-inflammatory cytokines, TNF-alpha and IL-6, are actively degrading cartilage and sensitizing your nerve endings. This lowers the threshold at which you feel pain. Strength training does not turn those cytokines off. It just adds load to a sensitized system. The source of that inflammation is often systemic. Chronic pain clusters tightly with metabolic dysfunction. Your knee is the alarm, not the fire. So you can strengthen the scaffolding all you want. If the building is still on fire, the alarm keeps ringing. We must address the terrain. Now the non-obvious part, ace and follow the money, because this is where it gets uncomfortable. The recurring loop isn't a bug in the system, it's the business model. A patient who relapses every few months is a recurring revenue stream. More visits, more co-pays, more billing codes. Symptom management is a subscription. Nobody in that model is paid to ask why your knee is inflamed, because the answer, your metabolic terrain, isn't billable as a procedure. The acellular carbohydrates and industrial seed oils driving systemic inflammation are the very fuel the system has no incentive to mention. So here's the blueprint. 1, keep the PT, but pair it with the metabolic workup it's missing. Fasting insulin, triglyceride to HDL, and HSCRP. 2, pull the fuel feeding the fire. Eliminate the acellular carbohydrates and industrial seed oils driving your systemic inflammation. 3, support the tissue's actual repair. This is where regenerative options work with your biology instead of just suppressing symptoms. Do that, and the strength you build in PT finally lands on a joint that's no longer sabotaging itself. You stop renting and start owning. Your knee pain didn't come back because you failed. It came back because the fire was never put out. Choosing to fix the terrain is metabolic sovereignty. At Regen.md, we treat the biology under the mechanics. If you're ready to stop running the loop, let's build the blueprint for your knee. Stop managing, start regenerating. Visit Regen.md, fix the terrain, reclaim your sovereignty. Visit us today at Regen.md. Your consultation is the first step to owning your recovery. Stop the loop, start the reanimation. We must understand that cellular signaling is the true language of your pain. When the NLRP3 inflammasome is active, your body is in defense mode. We utilize targeted defunctionalization in audits, SGB and SPG blocks, to reset the sympathetic nervous system and clear the noise. By modulating TNF-alpha and IL-1 beta directly at the source, we create the biological window for PT to actually succeed. Remember, muscle is your organ of longevity. It is the body's primary metabolic sink. We strengthen it not just for load, but for regulation. Preventing sarcopenia is essential for glucose regulation and structural integrity. This is the intersection of strength and sovereignty. I repeat, the system has no incentive to cure you. A cured patient is a lost customer, and managed patient is a lifetime subscriber. The shadow consequences, medical debt, and lost productivity are ignored by the corporate insurance model. We do not ignore them. My final directive to you, stop managing, start regenerating. The fire in your terrain must be extinguished before the building can be rebuilt. At our Whitson Road facility, we provide the forensic audit the industrial model refuses to perform. We fix the biology. Go to Regen.md today. Schedule your consultation. Stop being a pain refugee and become the sovereign seeker of your own recovery. Visit Regen.md. Fix the terrain. Reclaim your life. Stop the loop. Start the reanimation.